Hello everyone. My name is Dr. Amartya Debnath. I am residing and practicing in Agartala city, Tripura, for quite a long time. We are seeing actually many cases in our day-to-day practicing life. Among this, most of the time we have seen that patients are complaining about their GI-related symptoms. Sometimes like they are complaining like heartburn, they are feeling like they are having chest pain, then chest tightness, whatever this. This is called gastroesophageal reflux disease, that is GERD, and it is quite a common symptom in our population. This they also complain that there is hyperacidity. They are feeling acid in their mouth, sore taste in their tongue or in their throat, a sore brush. All these things are GERD, and there is a common association with diabetic patients. What is that? There is a quite a factful association between GERD and diabetes. How can we resolve this? What are the causes you need to know? In GERD, there is basically the relax of the the upper portion is esophagus, then it continues below its stomach. When the food comes down, it comes down through esophagus and is propelled through stomach. And whenever the stomach is full and the lower junction of the esophagus and the stomach, this muscle is tone is relaxed, then we get that gastric contents comes upside. It regurgitates or it reflux back into the esophagus, which comes to the sometimes it comes to the mouth also. These symptoms, that is heartburn, that they are complaining burning sensation in their chest. What is that? Hyperacidity or GERD. That is gastroesophageal reflux disease. What are the simple things you can do? Mild lifestyle modification and dietary changes. All this helps quite maximum time it helps without any drug or maximum 60% cases it resolves with lifestyle modification or dietary changes. How can you do this? That is smart eating tips. I can suggest you some smart eating tips that you can apply in your day-to-day life in case of in GID patients with diabetes. That healthy eating is an important role that played in our lifestyle modification. If you take high calorie food can lead or sugary amount food, it can lead to high sugar in your blood. That it increases blood sugar, and low calorie food, yeah, it also reduces or low sugar containing food that can reduce your blood sugar. So you need to know that some foods that trigger acid reflux that you need to avoid during your day-to-day life. So you should avoid food before lying down to bed, immediately before lying down to bed, before exercising. You should not take any food. You should avoid some drinks like cold drinks, cola, tomato juice, coffee, tea. That also triggers your esophagus or it irritates your esophagus and it causes gastroesophageal reflux. It also increases stomach acid in your stomach that causes GERD symptoms. So some sugar sweetened drinks are there that is rich in calories. We should avoid this type of drinks. That is beverages. Some soft drinks are there, Coca-Cola drinks, Coca-Cola. That really deteriorates your esophageal lining. So you should totally avoid this. I would say rather stop drinking this type of drinks. And also you should stop alcohol also. The alcohol consumption is really harmful to your body, really harmful to your stomach lining and in GI lining, and it will cause GID symptoms. Basically, diabetes also really harmful. So what will you take? You will take some nutrient-rich foods like fruits, that is not fruit juice, but fruits. Then vegetables that are high in fiber content. Then whole grains. It will help in your digestive system. You should avoid taking refined carbs like white bread, snacks that you usually take for refreshment type. So you should avoid this type of foods. And what you can do, you should avoid taking large meal. You should take small meals. Frequent times you can take small feeds, but should avoid large meals. That will prolong your digestion. It will increase your gastric capacity. It will make your food to stay longer in your stomach, and that will relax your lower esophageal sphincter, and it will cause reflux disorder. And so you should avoid taking large amount of meals. You should avoid eating during bedtime. Take your meal early in the evening. You should take your meal early so that it will take time in digestion and it will help you to sleep peacefully. You should take whatever you take in breakfast or lunch. You should take a minimal amount, but you should take lighter meal at dinner time. That will really help. You should eat in a calm and non-stressful environment, stress-free environment. You should, whenever you're taking your food, you should chew it nicely so that it helps in digestion. Whatever saliva it comes out, it helps in digestion. And what you can do, you can balance your food and diabetic medicine. Too little food with medicine really lower your blood sugar, may cause your hypoglycemia. Minimal amount you should take, not too much, not too less. Too much will cause hyperglycemia, and too less it will cause hypoglycemia. So you should balance your food and anti-diabetic medications. Because some anti-diabetic medication can lower your blood glucose level. Their main target is to lower your blood sugar level. So if you take too much little food, that it also hampers. So you should take adequate amount of food. What next you can do? You can take a plate. You can apply plate method. That is, you take a plate. Half of this will around. You can take a 9-inch type of plate to balance your meal. Half of it will fill with less carbs. That is vegetable items, lettuce, broccoli, or salad type item, green beans. Half quarter, 1/4 of the plate it will contain lean protein. That is fish, egg, or you can try with beans. And another quarter, you take fruits, vegetables, or whole grains item that you can this plateful amount really balance your meal. That is, you take your balanced diet. That really helps in your GERD symptom. And what next you can do? You can reduce your weight. That obese persons are really suffering with GERD symptom. So you should reduce your weight. You do exercise, but not at just after taking meal. It will cause GERD. So you better do exercise in the morning. You can don't lie down immediately after taking a meal. After taking meal, you can do some walking, simple walking or mild walking. Like don't do too much exercise. Just 10 minutes walk will really help in your digestion. It will go down your. I mean to say, it will help in the food to reach down the stomach whenever you walk. It helps in digestion also. So another thing, whenever you eat, don't lie down immediately. Stay your position. Stay in an upright position. That helps in propulsion of the esophagus. That food in your esophagus to propel the food down to the stomach. Sometimes some patients they are often say that they are having nighttime symptoms of heartburn. They are having chest pain that really mimics with heart attack. They feel like they're having heart attack. Nighttime, whenever you are sleeping, you suddenly wake up with chest pain. That really mimics with that is heart attack. So these are called nocturnal GERD. That is heartburn or gastroesophageal reflux at your nighttime. What we can do in this case, to increase the head whenever you sleep. When you are going to sleep, you try to elevate your head by putting down two pillows below your head. So sleeping in this way, it decreases the nighttime reflux of acid. Whatever you can do, you can lie in your right lateral position. Whenever you sleep, you stay in your right lateral position. Don't sit in your left lateral position. Avoid physical activity just after eating. Avoid drinking alcohol. Another thing, alcohol it decreases your blood sugar level in diabetes. So it also cause hypoglycemia in diabetic patients as they are taking some anti-diabetic drugs that also reduces your blood sugar level. So both will cause hypoglycemia. Better to best to avoid alcohol. These are the few points I would like to share. So you can apply this in your day-to-day life. So managing GERD and diabetes together is really a significant task, but it really improves your overall well-being. Eating balanced diet, then avoiding triggering foods. Whatever I have said, you should avoid this type of food, and you coordinate your meal with the diabetic medicines, as I have suggested. You maintain stable blood sugar level, and you manage your symptoms of GERD by this type of activities. Other than this, whenever it does not work, we give a short few weeks of PPI trial, anti-GERD medications. That is, we use PPI like drugs omeprazole, pantoprazole. This your doctor will advise. They will suggest you for 8 weeks or 4 weeks of medication. You should strictly go through this trial. Should strictly follow this course. Otherwise, you will take a few days. Then you stop. Whenever you feel good, you stop your medication. That's not the way it will work. You should take your medication as your doctor has advised. That is PPI. And now in market there is a new drug that is vonoprazan, which has recently been established. It has also a great role in taking care of GERD. Or your doctor may advise you with that is H2 antagonist, that is ranitidine or famotidine. This type of drugs they can advise you to take. Apart from this, I would best suggest that you should follow your dietary medications. Change your dietary habits, change your lifestyle habits to modify this type of things. It will really help in your GI, controlling your symptoms of GI. That's all. Thank you.